Sonia, if you could please share the presentation when you are able to.
Shared. Gabriel, you can start.
Good morning, good afternoon, good evening, everyone, and welcome to today's webinar on data-driven decision-making in public health supply chains, presented jointly by UNITAR and Empower School of Health. My name is Gabriel Suazo. I'm joining you all from the UNITAR headquarters here in Geneva, and I'm delighted to be your moderator for this session. In this webinar session, we will be exploring three main topics: how data-driven decision systems enhance forecasting, procurement, and delivery of essential health products, the role of data intelligence in improving transparency, accountability, and performance in supply chain management, and finally, practical approaches to integrating digital tools for more efficient and equitable health systems. We have two keynote speakers with us today who will share their expertise and insights, and we encourage you to please engage throughout the session. Before we continue, I would like to start by presenting you with the agenda for today's session. We will start with housekeeping rules directly after this. After that, we will start a participants poll to get to know some of you and your backgrounds. Then we will introduce the speakers, our two panelists today, followed by their main presentations. After their inputs, we will have a secondary poll to help us understand your experience and training interests in data-driven supply chains, followed by a Q&A session, which you can participate in via the chat. We will wrap up with some closing remarks and some follow-up information before we close the webinar. So for housekeeping, I would please welcome all of the participants and people who have joined our stream to kindly mute your microphones and keep your video off. Please ask questions when prompted using the chat box or raising your hand in the icon. Please participate in the polls as well so that we can know more about your interest. And please take note as well that the webinar is live on the YouTube homepage. I will now proceed to open the first poll that we have mentioned to you. So please use the Zoom platform. You should have it show up on your screens right away. And we will be monitoring the responses that we get to be able to learn a bit more about you. All right, so I see that we have some answers coming in. Thank you very much. We would also like to take this opportunity to once again, please remind you to participate in these polls as they are very beneficial for us and they will help us learn more about you and to be able to engage with you better in the future. Very great. So I see that we have some participants who have an academic background in pharmacy masters as well as PhD. There's public health, some engineering, data science. In terms of geographical region, we have a very nice mix between Africa and the Middle East, as well as Asian countries and European countries, as well as some interesting demographics for the ages that are represented here. It is also nice to see that we have a wide variety of experience across the participants in terms of work experience in this public health and data-driven sector. What sector are you working in? Again, a very nice spread between national government, state government, NGO, academia, and research. So thank you very much all for participating in this poll. I will keep it open for 30 more seconds just so that we can keep getting some responses. I see as well here that there is a definite interest in supply chain management and procurement, followed by pharmacy, especially in the areas of work which you are all coming from. And a lot of people working in organizations related to pharmaceutical and med tech industry, as well as academia and research. So I thank you all very much for participating in this poll. And I would like to proceed now by introducing our first speaker and panelist. So our first speaker is Ms. Rachel Msimuko Muyoma. She is a pharmacist and supply chain specialist from Zambia, a pharmacist by profession with postgraduate qualifications in global health procurement and supply chain management, as well as in management and in leadership. She has over 14 years of experience in the public health sector at various levels. Very importantly as well, she is a student of Empower School of Health, a 2017 Mandela Washington Fellow in Public Management with Syracuse University. She currently leads the supply planning unit at the Zambia Medicines and Medical Supplies Agency. Her professional passion is very much rooted in strengthening supply chains for health commodities, promoting evidence-based decision makings, and helping build local capacity in health supply chains. Rachel is also an accomplished and published author and mentor, actively guiding young supply chain professionals and advocating for career development pathways within public health supply chains. So, Ms. Msimuko, I once again thank you for your participation and for joining us today. I will now pass the floor to you.
Thank you so much, Gabriel. And good afternoon, good morning, good evening to all the participants in the webinar. Thank you for taking your time to join this webinar. Very passionate about data. And as Gabriel alluded to, I've spent 14 years in the public health sector supply chain and have experienced the use of data and the evolving of the data at various levels. And wanted to just start with talking about the power of data, at the core of any effective supply chain is data. And this is very, very true in the public health sector. We are not able to have an effective health supply chain if we do not have information to guide the decisions that we're making. So all the supply chain functions that we do, starting from product selection, hinge on data. What products am I selecting? Why am I selecting those products? Do I have the people that need those products? What are my disease patterns? That data is needed for selection. Then forecasting, you need to understand the volumes that you're anticipating to deal with in terms of patient numbers, and also understand your consumption patterns for you to forecast. And also in terms of supply planning, what sources of commodities are there? How soon? What are the lead times? What do you have? And then also the procurement decisions. How are you procuring? Will you have framework contracts? And how do you distribute the commodities as well? You need data. Everything requires data, and that's the power of data. And it has continued, as I mentioned just as we started, it has been evolving. I think I'm coming from Zambia, just evolving slowly from manual tools where people are using stock control cards, and it's moving onwards towards automated, integrated digital systems. And even as we ride the sophistication of the data, the reason why it's even being more sophisticated and it's being improved is because it definitely has power. And what data gives you, most importantly, is evidence. Evidence that what you're doing is making a difference, evidence that what you're doing is actually needed, and evidence also if there are issues that need to be addressed in the supply chain. Can move on. We can move on. So just lessons that I have learned across my practice. I started out as a district pharmacist in a place called Mukushi District in Zambia, in the central province of Zambia. And over the time, I worked as a district pharmacist there. In terms of managing the supplies, we had a mix of urban and remote facilities, facilities that were accessible and facilities that were hard to reach. So we even had some facilities which in the period of the rain season, we could not access in terms of supplies. And firstly, there was a big reliance on paper stock control cards at district level and even in the health facilities, and manual reporting forms. And we moved on to digital systems like the electronic logistics management information system, which is there in quite a number of countries now. And how we moved to it, most of the facilities were sending a paper-based report, and at district level would enter that data onto the digital system to have that data available. But before we actually had that digital system, we're using simple spreadsheets. So we were collecting data from the paper-based forms just on their stock, what stock did they have, what did they receive, and what did they use every single month. So just a simple spreadsheet. And what I would like to emphasize is, even as we are talking about data-driven decision making, we need to understand that we need to value our data, or we don't need to look down on certain data. Even the simple data that you collect, receipts, issues, stock on hand, if you are collected consistently, accurately, it is of great importance in decision making, because it tells you what you have, it tells you what you've received, and then it's telling you what you're utilizing. And then even as you have that information, you can now make decisions that will help improve medicine availability within your sphere. Where you're working, be it at a hospital, be it at a facility, health facility level, or at national level when you're managing from the central level. We can move to the next. So the previous slide, I gave more or less an experience of when I was at district level, managing from that level of the supply chain and how our data looked like. And then transitioning now to more of at the central level. Most countries tend to have a central medical stores where they coordinate, of course, the distribution across the country. And in my experience in inventory management and inventory operations at a central medical stores, data is very important, because we're using it. We need to know how much stock we have. Those are the stock levels. How much are we, the consumption patterns of our facilities, the demands that they are placing on us, and how we're fulfilling those demands, the turnover rates of the inventory, so that you're not keeping stock for too long and you're ending up with a lot of expiries, and also tracking your wastage, how much of stock that you're actually wasting, so that you bring it to the lowest minimum that you can, because coming from Zambia and other countries that tend to be on the lower middle income side, there's not much money to go around. So you want to minimize waste as much as possible, save costs where you can. So the decisions that we make from that data is, I know my stock levels and I know how much I'm giving in terms of demand from my facilities, so I can determine my replenishment cycles. And then I can also determine what to procure and when to procure, so that I maintain stocks, so that the central level, of course, can maintain the stock that are needed for them to fulfill the orders that the facilities are coming with. And aside from just satisfying the needs and ensuring that medicines are available at the service delivery points where the medicines are needed, the data at a central medical stores serves an operational compass. How are you doing in managing operations? How timely am I providing service? So at a central level, we're looking at the schedule adherence. So the delivery on time, in full delivery component. Are we able as a central medical stores to deliver the products that are needed by the facilities when they're expected? And of course, the cost of operations. The more inventory you're having, the more costly the operations are, and even other factors that look at how stock is managed at the central level and how the distribution is being done. Is it being done in the most cost-effective way? Are you managing a huge fleet? And are you able to, do you have the funds to actually manage the fleet that you have? And is it the most cost-effective way that this is being managed? So in summary, the data that we have is very important at a central medical level, central medical stores level, to drive efficiency and also cost effectiveness. We can move to the next. So just after talking about the importance of data in those aspects, we need to use that data, of course, to make the decision. So we need a data to decision ecosystem. So how are we accessing the data and able to make decisions in using that data that will allow us to ensure that there's a consistent supply of medicines and medical supplies across the public health sector supply chain. So in looking at that, we need to look at the accessibility of the data. How easily is it accessible? When you have electronic systems that aggregate the data, summarize the data, it makes it much easier. And then where is the data being captured? If we have a lot of different systems capturing different aspects of the data, how are the systems integrated so that you can have the information in a central place for you to make decisions? And dashboards are very helpful in that instance, is that they facilitate that decision making. You can create a dashboard centered on your KPIs, on time, in full, stock availability, and maybe even cost, depending on the KPIs that you're tracking. And as you have those dashboards and the visual aids, certain things will make you realize that you need to make a decision. For example, in terms of stock levels, if it's showing that you're going into red, you need to make a decision. So having that access to the data and dashboards help you become more proactive versus reactive. So instead of waiting for a stock out, you're able to act before the stock out happens. Or instead of waiting for wastage to occur, you are already able to predict, because you're looking at your overstocks and your utilizations and planning ways in which you can ensure that that stock is distributed in time and it is utilized. So looking at having that data analyzed, not just collected, then helps you guide redistribution, for example, so that you do not end up with wastage in certain areas of a product that is needed in other regions. And then also aid procurement decisions. Do you still need to procure when you still have adequate stocks of a certain commodities? And so make a decision on whether saving that money from that procurement and of course targeting it and channeling it to other needed supplies. We can move on. So just a few examples of data in action. So forecast rationalization, for example, a forecast may have been made with regard, for example, to a specific antiretroviral medicine. And as time goes on, there are differences in practice, there are changes in practice, there are newer molecules that come on which have better side effect profile and also better treatment outcomes. And even as you are looking at what you need to forecast for a certain program, using that data, you may make decisions to reduce forecast on certain products that you will not continue to be using because of the emergence of better molecules on the market. And as you do that, you can avoid expiries. And also just understanding what is being consumed by your facilities also helps you rationalize your forecast, because if there may have been certain data that would have indicated based on disease or a change of treatment guidelines that this is the product that you'll actually be using. But then you look at what is happening in the facilities, you find the facilities are not all adhering to the new treatment guidelines. So you may find that the new molecule isn't moving as fast as you anticipated it to move, or the old molecule, and the old molecule is still being consumed at a higher rate. So you have to always compare your forecast versus what is actually happening downstream. And then also the need to align our supplies, what we are procuring, the medicines that we're procuring in terms of the patient level data, like the treatment load that we are anticipating for certain programs. For example, malaria, what is the incidence rate looking like, and what product are we using the treatment guidelines, and how much do we need for that product? And as we are looking at the service statistics and looking at how much is actually being used. So I gave an example of malaria, which in my country tends to be seasonal. So based on the seasonality, we're anticipating, for example, more malaria incidences at a certain period of time. So it means that we need to align our supplies to make sure that our highest rate in terms of stock levels are just as we are entering that season, so that we mitigate against stockouts in the period. We can move on to the next. So yes, we need data to make decisions. We need to make data-driven decisions, but we do have challenges with the data itself. So, and we need to be alive to that reality. In my own country, and maybe this might be the same case with other countries of the participants in this webinar, there are times when there's delayed reporting from the facilities or incomplete reporting. So you do not have the data that you need to make decisions at the time that you need to make the decision. So that is so that is an instance that a challenge that we are facing. Then there's limited data literacy across certain sectors. We're dealing with all sorts of health facilities, different people managing medicines and medical supplies, and they may have limited understanding of the data that is being captured in terms of the logistics data, the importance of that data, and how best to interpret what that data is giving. And of course, there are system silos, which are realistically there currently, where you have patient records, electronic health records are just dealing with the diseases, and then you have another system that is looking at the logistics, and maybe the two systems are not looking at each other. So so there is so those are the challenges that are there. And then in terms of there may be resistance to change in adopting digital tools by people that are supposed to utilize the tools. Sometimes it's because the digital tools tend to be more complex. And then there's always need. One of the lessons, of course, just moving from the challenges, is the need for simplified tools for having, for collecting that data, tools that are easy to use, that people easily accept. And then there's always need to continue building capacity, strengthening the ownership of systems in the public health sector. And the reason I mentioned ownership of systems is historically we've had quite a lot of support from partners that support a system that is not owned by the actual government or public sector. So at a point where there are challenges in partner funding or close out of projects, that data is lost, or the collection is seized. So there's need for ownership of the systems in the public health sector so that there's continuous utilizations of the, there's continuous utilization of the data. And then also we may have systems that are able to capture data, but we need the people to value it. So it is not enough to have systems that are giving you the information. It is important to have people value that data, because if they don't value the data, they won't look at it, they won't collect it. So that is the balance. So you can only really fully utilize the data that is being generated by the systems when people actually value the systems. We can move on. Okay, so there is need. Okay, yeah, so there is need to have investments in people and systems. So there is need for staff training, which should be regular and planned, and it should be made in such a way that it's done in the most cost-effective manner, so that you have a way to access the trainings in the most cost-effective way. For example, webinars, and also on-site where you have champions of certain systems closer to where the facility is utilized. So you have a local champion who's able to easily provide mentorship or capacity building to different facilities that are in the vicinity. Then it's also important to ensure that while graduate and postgraduate trainings are being done, the importance of data is emphasized. And here, because I'm a student of Empower and UNITAR, one of the things that I have learned, okay, yes. So apologies, I have someone just walked in with something urgent. Yes, so it is important that in terms of the trainings, the data is emphasized. I tend to hear Professor Andy's voice in my head because he typically mentions it in almost every module. It's not enough that there's that data. You need to be able to understand that data and use it to advocate for changes and improvement. And then also there's always opportunity to be innovative about how you train others and capacity build them. In my unit, we created like a learning hour where we can have a session where we have peer knowledge sharing on different aspects of supply chain management. And then it is very important to mentor young people who are coming up in the profession, maybe not restricted to supply chain, but in all professions. And just as part of that mentorship, include the aspect of data. And then, of course, as we're mentoring the young supply chain professionals, we are definitely building the next generation of data champions. So looking ahead, there's a lot that is changing in data. So there's a lot of AI coming in, and it helps. There are certain decisions that you may not need to have for example, you need to sit through, and there are certain automated decisions that can actually be programmed through your AI application so that those decisions are made timely. Then, of course, there's the push also for regional data sharing. We're having instances where post-COVID, I think a lot of regions have realized that sometimes it's difficult to go at it as a country alone. But even when it comes to the supply chain, if you're coordinating information as a region, knowing your volumes, knowing your capacity to produce and other aspects, you can be able to utilize and leverage that data to, for example, get better costs for the drugs because you are sharing information as a region. I would know what Botswana is spending for a certain commodity, and I'm in Zambia, and I look at the cost, the amounts that I am being charged, and trying to look at the comparisons. And then there's nothing that would stop certain countries, as there's regional data.
So unfortunately, I think that Miss Msimuko might have had a problem with her internet connection. We will see if she can join out.
They are engaging manufacturers, competitiveness in pride. There's a lot, the capacity, but each country going at it alone sometimes doesn't make business sense. So it's good to coordinate. And so I just want to thank you for the attention to what I had to share. And I'll be handing over to Dr. Thun to take over. Thank you.
Thank you very much, Rachel, for this very, very comprehensive and holistic overview of the role of data and how it really is so important to help transition from being a reactive to a proactive entity, as well as your comments on upskilling people and how examples of data in action and all of the lessons and the challenges that we have to learn still on data management. So thank you very much for your comprehensive and informative session. And thank you once again for joining us today. I would now like to introduce our second speaker, Dr. Aung Thun. He is a medical doctor with over 13 years of experience in public health and development, specializing especially in supply chain management, stakeholder engagement, and program implementation. He is currently serving as a program analyst at UNFPA Myanmar. He leads initiatives to strengthen national health systems and ensures the effective delivery specifically for reproductive health commodities. He has a varied career, having roles at UNFPA, Médecins Sans du Monde, as well as with local NGOs, and a lot of extensive work in HIV prevention, care, and support. So Mr. Thun, thank you very much for joining us today, and I will now pass the floor to you.
Thank you very much, and I'm happy to present about the data, evidence-based data and decision-making in the public health supply chains. So we need the data, but why is data-driven decisions are crucial in the public health supply chain, and then it is due to the, we have to make every decision and affected procurement and supply chain management, and it is really important to get a reliable data, and source of the data are really important. And in each decision involve millions of dollars whenever you procure a high value of supplies and commodities, and it affects on the lives of the people in the public health. So that's why the data are really data-driven decisions are important in the public health. And whenever you procure, you may also need to decide the quantity of the supplies and then the inventory, how many inventory order that you need to be fulfilled in each health facility. So at the price, we can and remember the economic order quantities. But if you don't have a data, it's kind of a lot of guessing on the data. It's like the square root of 2 times a guess times a scientific guess by the technical person divided by the precise guess and times management guess. So there's a lot of guess in the even in the scientific formula and equations that were produced just only a guess. So the evidence and data are really important to make decisions in procurement and supply chain management. Next slide, please. And then, as Benjamin Franklin said, that if you fail to plan, and it's plan to fail. So that if you didn't properly plan to fail to plan, whatever you implement, even including the procurement and supply chain management, it will be fail. So we had that in most of the LMIS are not functioning. It is quite difficult to get the data for the PSM, and maybe the data are outdated and not accurate. So it's due to the poor planning. So we may need to make a evidence-based decision and data-driven decision, and then we have to conduct make a proper planning and to get evidence-based data and real-time data. And sometimes, as Richard already mentioned, that the importance of data in the decision making, and most of the people are reliant on the softwares and tools and even now and AI. But if you import the wrong data or maybe guess a lot of wrong information, that such kind of softwares and tools will generate only the wrong guess or wrong outputs. So if you don't want such kind of result, you may need the build a systems first, whether it is paper-based or good or functioning system in your country. Otherwise, such kind of data could generate only the false information. And sometimes in our countries, is very sensitive to and less tolerance to report for the wastage or expiry drugs. So at that point, sometimes the service providers or healthcare providers reported as the waste of expired drug as a dispense to user data. So at the point, even though we could set up the electronic LMS system or whatever software we use, these data will become the consumption data. And then what in the next procurement cycle, if we use that kind of data and information, there's a lot of waste of the money, a lot of waste on the resources, and wasting the life as well. So it's important to make a decision, data-driven decision, and the inputs are also really important. Nowadays, the international communities, donors are, demanding on the use of the evidence-based decision making. And in the, you may also know that there is a commodity flow in the logistic and supply chain, and there must be a information flow. Without the reporting back to the utilization of data, it is difficult to get another batch of the supplies. So the same principles applied for the donors and donor communities, and they need to put the and reinforce to use the evidence-based decision and making in the procurement and supply chain management. So previously we used to say no suppliers, no program, but nowadays it's because no information or no data, no information, and become no program or no funding in future as well. So it is important to get a real time or data-driven decision making in the procurement and supply chain management. Next slide, please. And you may also need to understand the concepts of the data and information. Sometimes, when you use a piece of data, but it is generally little value themselves, for example, like you issue 100,000 tablets of paracetamol from your warehouse, but it's just only issue data from your warehouse. But when you compile these data and analyze these data, for example, like at least 3 consecutive months of issue data or consumption data, that will become the average monthly consumption AMC. And you may have a stock on hand, and then you can decide on how many stock you have, man of stock in your warehouse, and then how many months you can supply to the head facility or something like that. So this began the information by gathering data and analyzing data and processing the data. So by compiling such kind of information, it can generate the knowledge and for the decision making and impact on the healthcare program. So that these kind of data and information should be effectively utilized in the as evidence for the every PSN decision making, procurement and supply chain management, so that you can promote the transparency and accountability throughout the supply chain, as well as effective utilization of data and information, and that changes to the valuable resource like supplies and indirect supplies of commodities you may have, and as an impact, there's a best as a result, there's a good outcome of the health program in your country or in your organization. Next slide, please. And then based on the information and is needed by the level of the people, sometimes the storekeepers or cleaning staff, they may need the much data or information. For example, like they have recorded everything, the dispense to user data, the stock on hand data, money consumption data, and high volume of detailed operational data are required at that level. And then, but at the the PSM manager at the district level or the national level, they may need summary or compile of this kind of data. How many are quantity that they need to procure for the next procurement cycle or something like that. So that at the actually and at the executive level or the policymakers like a minister, they may need the highly summarized information and data, maybe sometimes graphic presentation and indicators for the entire health program, as well as all the procurements of the whole country or something like that. So that we may need to understand how we can present the data and change into the information to the different levels of people for the strategic purchasing or procurement and of the commodities and the supplies. Next slide, please. And then these kind of data need to be accurate, and the quality of data is very also important. Richard already mentioned that sometimes that kind of data comes from the very visit level or regular updating of the stock records, the clinics records, dispense to user data. Otherwise, if you are not regularly updating such kind of data and information, and even though you set up the very sophisticated software or system, LMS system or other kind of different kind of system, and that will produce the wrong data. Sometimes we have very limited data in our system, and that capture very few data. For example, like we have no data on the day out of stock. So at the point, even though the facilities are stocked, we cannot calculate the adjusted consumption or something like that for health facilities. So it is really needed to capture the essential logistic data as well as other service data and from your system, and then it can be automated by the different software and tool. If the source of the data and the quality is the best, you can have a best calculation or for the full forecasting of the quantification for the next procurement cycle. Otherwise, as previously I presented, it will be the a lot of guesstimate, and then it will your procurement and management will also be filled. And then you may also need to train the BSM staff member, and then you have to motivate them and to have a common goal for the usefulness of the data in the BSM decision making, so that when they understand that the importance of the data and information, whatever they report within the BSM system, they can taking care of the data accuracy, and then complied with all the procedures, policy procedures, so that your data quality could be also improved, and you can make a data-driven, evidence-based decision making in the PS and procurement and supply chain management. And in addition, you may also need to provide the supportive supervision and motivation to those staff member. I have experienced that in our country, we apply the quality improvement change approach to encourage and motivate those staff members who are reporting regularly and reporting accuracy, high reporting accuracy in the logistic data, and as a result, they can request the required quantity of the supplies. And previously, we applied the push system. Now, then we changed push to pull system. Whenever they can request the quantity that they need, they getting motivated, and then they value the data that are provided or reported to the higher level, and then the system began functioning. So in such way, we can strengthen our system, healthcare system, including the logistic management information system, but the accuracy as well as the source of data is really important. And you may also need to verify such kind of information or data or report and by monitoring and or something like that. Sometimes, even though the lower level step may report at the automation process, people can make mistakes. For example, like even though you reported the consumption data as of some particular products as 3,000, but when at the times of the data entry, the people could enter zero for a long time. So there may be the multiple zero behind the 3,000 or something like that. So such kind of error could be happen in your system. So that you may also need to verify the data and check regularly and make a trend and then make analytics. Otherwise, if you blindly trust on the data generated from the system, it could be an error also. So if you find out some kind of abnormalities, like abnormal spike gap of the utilization of data, what happened to that particular region, or maybe a health facilities, whether to find out whether it is the errors in data entries, or maybe whether it is due to the some kind of outbreak or disaster or the source or seasonal outbreak or something like disease outbreak or something like that. So if you find out the source, you can take a correct action on that one. Yeah. Next slide, please. And then you may have to reconcile all the data and information that you get to make a comprehensive decision. And sometimes we may have a different kind of information system, like a logistic management information system, LMIS, that can capture the data for inventory, storage, utilizations, and then the procurement or something like that. And then sometimes most of the countries, we also have a health information management system that capture the information on the patients on demographic, the morbidity, disease patterns, and also the modalities, the death of the patients or something like that. So that by this the service that you have provided within your healthcare system, and also the utilization of the supplies or commodities, you can compare on that. Sometimes based on that information and data, you can make changes for the improvement of your hacker system. For example, like rational use of medicine and could be applied by comparing the service informations and also utilization of the logistic data or logistic information like consumption data. And then additionally, financial management information system, most of the healthcare system, organization like UN agency are using enterprise resource planning tool. Such kind of financial management and planning tools or system are using to estimate the budget required for the procurement and shipments and also distribution, all those logistic function. So this information from the different systems, you may also need to review, analyze, and then make a comprehensive decision for the procurement and supply chain management. Next slide, please. And then when you have a kind of functioning system, you can add the additional tools or software for the better outcome or facilitate the information in the decision making. There's a lot of tools I have mentioned here for pipeline tools like forecasting and supply planning, Quantimat for the quantification, OBLMS for stock management and stock report. In addition to that, there's several tools we are using like MSupply and also the Logistic or such kind of logistic information system tools, data information system tools that are available across the country. But you need to, the most important thing is that the imports of data are really critical to make a better output and outcome for your decision making. Next. So then you can make this information to take action. So these are the steps I have mentioned for your information and for data-driven decision-making and action. So as I mentioned, you may also need to review the report and information. If it's mentioned some kind of abnormalities in the trend, and you have as an expected high or low, you have to review it and then get a deep analysis on that one and what wrong is there, and then you have to find the causes. Otherwise, don't blindly trust on the data and information generated from the system. And then you have to investigate and verify the data. Sometimes, even though you are using a lot of tools or software, that could happen the technical error. And sometimes, even though it is the web-based software or information or data, that can generate the wrong information. So sometimes you may also need to make a manual calculation and compare with the result generated from the system or software, and find out consult with your colleagues and then communities and people to take appropriate action, and then finally you can take an action to make mitigate the risk that you have, the root cause for the procurement and supply chain management. So these are the steps for the data-driven decision making. And then next slide, please. So in summary, do not prioritize the software. Try to build the system first, and then if you have a functioning software system, you can add on the software or tools anytime, and then you can focus on the decision that they need that may cover a lot of evidence-based decision, strategics, and operational performance management. and you have to make sure data quality. If you put the wrong information, and there's whatever kind of software or tool that will generate the wrong data or wrong outputs and information. So, and then you may also need to link with the data collectors, like a cleaning step, PSN step member, logistic focal points, and warehouse focal points. These persons are really important. Please provide the capacity strengthening plan for them, and then training for them, and then provide the supervision, and then and then you can generate a lot of very useful information and for your decision making. And then finally, transform these data into the information for the decision making for your procurement and supply chain management, whatever in your country or in your organization. So that's all my presentation. If you have any question, please feel free to ask. Thank you. Over to you, Gabriel.
Thank you very much, Mr. Thun, for your input and for your participation. It's very much appreciated. Indeed, taking an overview as a system as being priority one before leading into software implementation and things like this, and the importance of data quality. Thank you for your inputs on these things, because they are very much important, and it offers a very technical aspect which we appreciate as well. Thank you. So now I would like to open the floor to some questions from our participants who have joined us today. Unfortunately, as I see that we may have lost Ms. Rachel Msimuko with her internet connection, I will direct the questions to Mr. Thun, if that is okay with yourself. And I will pick from a variety of questions that we've received, both in the chat as well as in the Q&A box. So the first question that I have here in the chat is from Mr. Mark Herringer. What role do open data standards and digital public goods play in strengthening data-driven decision-making across global health supply chains?
Yeah, thank you. Actually, we are using the data for the effective PSM decision making, but sometimes we have a very limited of data. So we are encouraging for the data transparency, openness, and then in every PSM decision making. But unfortunately, nowadays, it's totally depends on the host government and also the organization to promote the data transparency and the use of data in the PSN decision making. But we actually encourage them to promote the data transparencies in PSM decision making. There's several factors that can influence the, for example, like pandemic situations and the humanitarian crisis, and then war. So such kind of situations are really challenging, and for the transparencies and openness in the use of data in the decision making. But is when we provided the actual data in the system, and that can generate the very precise informations for as evidence-based information to make a decision that can save a lot of lives for our community, peoples, and countries, and also the globally as well. So yeah, I hope I can address this question. Yeah, thank you.
Yes, thank you. Thank you very much for this input as well. And I think building off on this, I actually have a follow-up question from another participant here. How do you deal with data collection challenges between district and central levels, you know? If you can build upon this, we were talking about regionality and government and things like this as well.
Yeah, thank you. It's really very practical in the PSM decision, and that sometimes we are providing the supplies through the from the central level to the district or regional level or district level, and then facilities level. But there's a gap of our information and due to the timings, for example, like logistic management information system, we frequently collect the data and information from the lower level of the health facilities, but the HMIS have information system normally collect like quarterly or sometimes biannually or annually the collected data. The frequency is quite different, and then also decision is also different, and for the to measure the performance of the Hackel system. But in the logistics system, is really important to collect the data and information with the very frequent interval for the resupplies intervals as well as the lead time. So normally it depends on the system that you may have in your countries or in your organization. Sometimes it's directly distributed from the central level to the facilities, or sometimes it's directly it may have a different tier of supply chains. So we collected data and information and as we distribute the supplies throughout the supply chain. But it could be linked from the central level to the regional level and district level and up to the facilities or service delivery points. And then if you have, it depends on the minimum and maximum stock level or supplies in the different tier of the supply chains, and that information need to be collected and reported back to the central level for the next procurements. Yeah, thank you.
Great, thank you very much for that input as well. Another question that we have is a bit more contemporary, actually. Do you have any examples of where AI or artificial intelligence has been used to inform supply chain decision making? Where would this fit in, into the role of the system first and integrating software? Any insights that you would have in this area?
Yeah, thank you so much. It's quite interesting. And I have used a lot of the softwares and tools, but nowadays AIs are more popular. But AIs, machine learning is still developing on projects, even and sometimes the data and information and for the AIs, even though we are provided inputs and they generate text, but they could have errors by comparing to the manual calculations or maybe the data generated from the software, previously the software or tools that we have used. So the AI is developing, but in future it may be integrated with the current software or tool that we are using. But and another thing is that whenever the data that we provided are inputted, that AI captures and storage. If the ownership is not your organization or for that particular AI or tools, maybe for the data, for those or person who have a concern of the data security or information, and it's better to not to upload such kind of data, so very sensitive data and information into the AI. But you can free to use currently the software or tool that you are using, that you or your organization is using. And otherwise, there's a risk of data. Sometimes we have a lot of concern about the malware. But we have very limited protection of our computers or laptop that we are using, and then even for the AI, we call the prompt injection. That is, there malicious prompts are injected into the AIs, and somebody could get data or very sensitive data from your organization. So that's why we stay waiting and learning for the development of AI, and that could be integrated with the currently tools or software that we are using for the BSM decision making. Yeah, thank you.
Thank you very much for that input. Yes, indeed, the role of data security as well is extremely important, and making sure that any intelligence models that we use are actually adequate in representing and not causing us harm with hallucinations. So thank you very much for your input on this. Related to this question, I think we'll only do a couple more here. What is the cost of inaccurate health facility data? How does this impact the dissemination or the network of supply chains, and how can this be overcome as well?
Yes, I can share my personal experience that previously in our country, we used to distribute the supplies with the quota system. For example, like if you have 10 regions, when you procure, whatever you procure, you can divide it into 10s and distribute it all equally to that region. But, the population in different regions are quite different, and the utilization is also different. So there's inequalities in the stock, and then as a result, in some region, there's a overstock, and while some region, there's a stock out of supplies. So then we decided to change the push system to the pull system. At the point, there's a state policy exit for the less tolerance or zero tolerance on the expiry drugs. So the healthcare providers or the logistic focal points in person, they reported the such kind of expiry items as a consumption data or dispense to user data. So if you rely on such kind of data and information, in the next procurement cycle, you will have to order the large amount of volumes of quantities, and there may be the overstock in your warehouse, and also is also wasted for the entire supply chains and health system, especially for the resource limited setting. So it's very important to import the very minimal level of the supply chain, like service delivery point and health facilities, to provide the accurate data and information and that they have reported to the higher level of facilities for the next procurement cycle, so that when that kind of system is functioning, you can decide the quantity of supplies that you are going to procure for the next procurement, that can save a lot of resources in your country, in your organizations, and also you can procure very critical of life-saving medicines and drugs, rather than wasting your resources on the non-essential or desirable items or that the data that wrongly reported from the health facility. Gabriel, you are muted.
Pardon me. Thank you very much for your input and for that personal anecdote as well. For it's very knowledgeable being able to learn about firsthand experience and things like this. So thank you very much. I would like to move on. I have one question here in the chat asking us about the different programs that we offer between UNITAR and Empower School of Health. So I would like to move on to this now. If we could bring back up the presentation onto the screen so that we can show our participants exactly what UNITAR and Empower School of Health offer in this space. So the main thing that UNITAR and Empower School of Health offer through their programming is the opportunity for further training in regulatory compliance, strategic planning, and decision-making in public health supply chains. It is very much a capacity development and professional development program Here you can see the courses that we have on offer. They are both long-term and short-term, so master's degrees of 24 months, 12 months for postgraduate diplomas, as well as some short-term courses, which are 2 to 6 months for certificates and diplomas. These courses are all in procurement and supply chain management, as well as digital health. The courses are self-paced, fully online, and really cater to the specific needs and requirements of the students who would like to participate in them. So here below, you can see 5 of the courses that we are offering. Master of Science in Global Health Procurement and Supply Chain Management, which is a 24-month program. A postgraduate diploma in Pharmaceutical Management with its 12-month program. A postgraduate diploma in Data Management in Public Health Procurement and Supply Chains. A postgraduate diploma in Digital Health, as well as an online postgraduate diploma in Global Health Procurement and Supply Chain Management. So we will also share all of this information with you all if you would like to receive it. And all of this can be found both on the Empower and UNITAR homepages if you search up UNITAR Empower Master's Program. So moving on from this now, we would like to move on to a final poll. And then after this, we will continue with the final Q&A session before we close here. So here, the poll should be started now for all of you to answer. So please, once again, I would strongly ask you and kindly ask you to participate in these polls, as it will help us moving forward to better tailor these webinars and understand exactly what our participants and prospective or interested parties would like to learn more about, or where they are from and things like this. So please don't be shy, participate in the polls, and we very much appreciate your feedback. Very nice. So I see some answers are starting to come in already. It seems that a lot of our participants here represent NGO and public health organizations as the primary sector, which is very, very interesting and also quite adequate. There is a very strong, very strong section of you that primarily use data for logistics and supply chain management, as well as monitoring and evaluation data. And there's a lot of interest as well in terms of what area would you all like to strengthen through professional training, supply chain analytics and dashboards, as well as data integration and digital health. Very nice. Thank you very much all for participating. Please continue to answer the poll. Nice. There is a lot of you who is the first time that you are participating in our webinar series. So welcome to you all. We hope that you have enjoyed the sessions thus far. And it's very nice and encouraging to see that there is interest. 70% of you who have answered are expressing interest to learn more about our programs between UNITAR and the Empower School of Health. Very good. Thank you all for participating in this poll. I will now like to take the moment just to see if there are any final questions or requests that any participants may have before we will move on to our closing of this session. And please remember to write your questions either in the Q&A area or in the chat section. Very good. Okay, I think there are no questions, new questions that I can see in our Q&A prompting box. So with that, I would like to welcome or thank you all for I see one question here actually before we end. If Mr. Thun, if you would like, or if you would be available to answer just one or two more questions before we go. Thank you very much. So one question that I have here is, what are the roles that some countries, if they're strengthening their digital health systems, for example, how can emerging economies build localized data governance frameworks that ensure interoperability as well as data privacy and sustainability? I think we'll answer this question and afterwards.
Yeah, that's great ideas that when you develop your own data and information system, as well as on the storage or information or data for your securities is good, but sometimes it has to be take times and a lot of technical inputs for developing such kind of system and software, and normally, we are working on the development settings, but sometimes, the unexpected, circumstances are happening, like a natural disaster. So at the point, and it would be better if you have a kind of backup plan, so that we not only are focusing on the development or sustainability, but we are also considering about the resilience or some kind of backup when and the information or data system are set up. Otherwise, when such kind of unexpected situations are happening, all the system or the work that you have built will be gone. So that's why it's really to balance in between development and also the resilience. Yeah. Thank you.
Thank you very much, Mr. Thun, for this last final answer to a question we have received. So I see here that we have not received any new questions as of now. And so I believe that with this, I would like to thank you all for participating. I would like to extend a heartfelt thank you to our two speakers, Ms. Rachel Msimuko, who's no longer here, unfortunately, as well as Mr. Aung Thun. Thank you very much for joining us today and for the very informative session. We really appreciate your contributions. And with that, I will say that we hope to see you all again in 3 to 4 weeks for our next webinar in November, which will be on essential data analytics tools for health supply chain professionals. So thank you very much for participating and have a good day.
Thank you. Have a nice day.